Barakada Salah, for those of you who are celebrating the end of Ramadan today, and for those of you who are at home, good afternoon, and welcome to this edition of our midday magazine program, Press Hour. The President of the Republic last Tuesday addressed the nation and had just one point in the entire 17 minutes address. That was COVID-19, and talked about the ravaging effect of this disease, what the government is doing, and what we should do as ordinary people to contribute to the fight against the pandemic. For once, we did not celebrate the May 20th National Day because of the disease, and so we won't talk about May 20 today. We'll still talk about the disease. We have a virologist to educate us on what is happening in Cameroon and around the world, and journalists to comment on your attitude and my attitude. Around the world, this Sunday, the WHO says that 5.3 million people have been infected by the disease, with 342,316 deaths, with 2,093,532 recoveries worldwide. That situation has not comforted us, because the situation in Cameroon, it has not abated either, because Cameroon has, as of WHO statistics, which the government furnished, 4,400 infected cases with COVID-19 and 159 deaths, with 1,822 recoveries. This far on the African continent, there are a number of countries that have been infected, but they haven't recorded any deaths yet. We have Rwanda, Uganda, Mozambique, Seychelles, Lesotho, and Eritrea. They have cases of COVID-19, but no deaths yet. And Africa, it was predicted, was going to be the graveyard of COVID-19, but it's happening otherwise, because the African continent and the African scientists are doing their best using homemade remedies, and people are also trying to see how they can use their environment to be able to build on that and fight COVID-19. We'll discuss that, and we have quite a number of revelations in the country. After Douala, we have the doctor here in Yaoundé and others who are also assisting. And the President of the Republic, in addressing the nation the other day, said, let's try them and let's go more scientific to be able to help not only Cameroonians, but the rest of the world. To discuss this issue with me on the program this midday, we have from my right, Cham Victor Bama. He's the publisher of the Municipal Update. You're welcome.
Thanks, Joe. Glad to be here again.
There is Dr. Joseph Fokam, a virologist. You're welcome.
Thank you, Joe.
And we have our regular face on the program, the publisher of the Guardian Post, Christian. Christian, you're welcome.
Thank you, Joe.
Okay. We would like to start with what the papers were feeding on this week, our press review.
News on COVID-19 continue to flood newspaper columns in Cameroon. The bilingual daily Cameroon Tribune reports on President Biya's 2 million masks offered to the population. The same 2 million face masks offered nationwide by the President on municipal updates. The Guardian Post reports that Minad Boss dispatches Biya's 2 million face masks nationwide. At the time, government opts for rigor discipline in the COVID-19 fight on Cameroon Insider, the Star quotes the communication minister warning to citizens, respect COVID-19 preventive measures or be punished. Then China offers protective equipment to External Relations Ministry and Cameroon Tribune just when linking all deaths to COVID-19 unacceptable on the Guardian Post. Then proactive English language newspaper publishers support journalists in COVID-19 fights on the horizon. The same Senpa donates anti-COVID-19 kits to media houses on the Guardian Post, just when Nico Hale lauds the media for its coverage of the COVID-19 in the country. At the time, over 100 COVID-19 suspects in Kondengi prison, as reported on the Voice newspaper. Then May 20 is celebrated in confinement on Cameroon Insider, as Cameroon remains united even without festivities on Cameroon Tribune. The national unity, national interest celebrated on municipal updates, especially as President Paul Biya's speech on May 19 reassures, don't panic, on the same newspaper. Then schools resume on June 1 on Cameroon Insider as Cameroon Tribune precises that only examination classes will resume on June 1, just before COVID-19 kills Prophet Frank on the Star newspaper. To the Horizon, Prophet Franklin Difona-Fanui dies at 40. Cameroon Insider writes, Prophet Frank is no more. The Guardian Post says controversy surrounds Prophet Franklin Difo's death as medics claim he died of COVID-19, but family says it suspects poisoning. To Cameroon Tribune, Franklin Difo passes on. The paper presents him as the 2018 presidential candidate and the founder and overseer of Kingship International Ministries. Before announcing the demise of Human Rights Commission Chair Dr. Chemota Divine Banda. To the Guardian Post, National Rights Commission Chair Dr. Chemota Divine Banda, former Kupe Maninguba MP Honorable Bob Nguchede died same day. Just when many people condemned the killing of Mamfe Mayor on Cameroon Insider, newspaper publisher Ako Kingsley dies on Municipal Updates. Then Customs seizes huge consignment of contraband drugs on the Guardian Post as Kribi Deep Seaport gets direct connection to Middle East and Asia. Government allocates 5 billion CFA francs to regional councils on Municipal Updates at a time Cameroon Insider sees rebuilding Northwest-Southwest presidential plan enters first phase of implementation with 36 billion handy to start projects. Then the construction contract of 14 automatic toll gates signed on Cameroon Tribune as the Muslim community prepares to celebrate the Feast of Ramadan on Cameroon Insider. Let's now end our press review with a story on the Star newspaper, where CRTV relay station in Bimbia, Limbe 2 subdivision, Southwest region, has been burnt down. According to Clara Wase of the Star newspaper, the incident, which is suspected to be the handiwork of arsonists, has been widely condemned by the population of Limbe. The incident, she says, has deprived many in the region of CRTV signals, with many hoping a solid fence and constant security watch would be put in place after reinstalling a new relay station. Until I come your way again, this is your Hour with the Press.
Thank you, Emanuela. We want to wish Elvis Teke a quick recovery. He just sent us a message that he wasn't feeling fine, so we won't have him. But that doesn't prevent you from watching CRTV Press Hour online. We're beaming live on Facebook and other platforms as well. So I'd like to begin with you, Dr. Fokam. Do you now know everything about COVID-19 from your laboratories?
Thank you, Joe. I think what's happening with COVID-19, we keep learning every day. So it's a learning by doing process, be it in Cameroon, be it in Africa and worldwide. So every day we are making sure we provide our own evidence update and also learn from the experience of others. And as you rightly mentioned now, worldwide we have approximately 52% of active cases of COVID-19. So people who still have the virus. But the good news is that among these cases, we have only 2% who have a kind of serious or critical condition. So now we know active cases is associated with lower rates of mortality. This is what we know worldwide.
Okay.
And also worldwide, we know America actually is still leading the epidemic. We have more than 1.6 million Americans who are infected. And amazingly, America also has like 11% positivity rate. So there is a high prevalence of COVID-19 really within those who have been tested in the America. And also worldwide, why we have like 6.3% case fatality rate. So those who are positive and who are dying, they are like 6%.
Okay.
In America also, we have more or less like 5.9% case fatality rate. Okay. So the highest rate of mortality is actually happening in the Americas. The good news in America also is that for yesterday, they have very few cases of new infection. So probably maybe we'll be getting...
Apparently their own graph is stabilizing.
Yes, apparently they have achieved their maximum peak. Maybe they will be decreasing. But we'll then see how it's going to happen. But for Africa, in contrast, we have realized, yes, there's not so many cases, but within this last week, we are seeing a kind of rapid kinetics also in Africa, and typically in Cameroon, where we had for a single day more than 500 confirmed cases.
528 to be more precise.
To be more precise, yes, confirmed cases just for 24 hours. This is quite alarming. It might be a good but also a bad news, because good news, it means our lockdown measures being shut down gives an open room for a rapid infection, a rapid transmission. Why? Because we can approximate that actually in our context, we don't have more than 20% of people who use their face masks regularly. Some of them have interpreted wrongly the measures being provided by the government, so they believe releasing the measures, probably for them it means the virus is no more there, or the virus is no more dangerous. So that's why we may be seeing this high incidence. But it's also because Cameroon actually has implemented an effective decentralization approach. Maybe let me explain what that means. In terms of testing in Cameroon, nowadays we have at least 6 regions doing the testing effectively. At the beginning, we were testing people from Boya, from Kumba, where I came from. I was born in Kumba, and I have been seeing positive cases from Kumba. But nowadays, we no more receive samples from Southwest. In Yaoundé, they have been tested actually in Boya. On the spot, there on the spot, and which also explain why we may easily test beyond 1,000 samples in a day in Cameroon. And that's why actually in Cameroon, we have tested approximately 20,000 people. This is not
in high-risk areas.
In high-risk areas, because they are either suspected cases or contact cases. Yeah, so this is what is happening. And maybe the very last thing we have also in Cameroon is that we have just like 3.6% case fatality rate. So almost like half of what we are seeing worldwide and in America. And this rate also is similar with other African countries. So meaning that effectively something is happening in the ground in Africa, and we really need to exploit that.
Okay. Is it not because of the relatively young population on the African continent as compared to the older population in the West, in Europe and in North America, for example? Yes,
Joe, we believe this must be one of the underpinning factors, because in Africa, the median age is like 19 to 20 years. So we are really relatively young in Africa as compared to Europe and America, where they have an average age beyond 60 years, more or less. Yeah, so younger age goes also with a stronger immunity. And once you have a good immune system, naturally you'll be able to better trigger the virus. But one issue also that goes around our immune system is also what we eat. It's also the temperature. We know we have so many evidence and discussion around how food habit may also influence coronavirus disease, and why maybe people in the village seems to have lesser risks of the COVID disease as compared to those in the urban area. Yes, simply because of their food habit as well. But then we talk also of the temperature. Temperature, why? Because we have realized an individual immune system is more active when the temperature also is high or is optimal. So during winter, the immune system also goes like asleep, and naturally the virus finds a favorable environment for propagation. Yeah, so being in a tropical context like Africa, I think we have so many factors that may contribute in alleviating the burden.
Okay. What about the treatment protocol? I'll come to maybe some practical advice which you might give those who are watching us later on in the program. But the treatment protocol, are you still holding on to chloroquine and the associated drugs, antibiotics for the treatment, or you have moved away from chloroquine and those who are treating are doing something else?
Okay, thank you, Joe. And this is really a burning issue, actually, in the field of COVID science. And why? Because on the 22nd of May, so just some few days on Friday, there is a recent publication from Lancet journal. Lancet is a very famous journal where WHO...
Scientific
journal, yeah. Yes, where WHO often get evidence to develop recommendation worldwide. So there is this study published by Merad and collaborator who did an holistic data collection in all the 6 continents and in about 671 health facilities. And they have now realized that when putting together all this data, comparing patients who were hospitalized only, just those who were within the hospital milieu because they had a severe or a critical COVID condition, they have tried to exploit if chloroquine alone, chloroquine plus a macrolide. Macrolide is an antibody, so azithromycin or maybe clarithromycin, and comparing this also with hydroxychloroquine alone or hydroxychloroquine plus an antibiotics.
Okay.
And then they also use a control arm. Control arm is those who didn't take any of this product. Then the result was really surprising. And nowadays we are like a bit, we are like coming back at the beginning of COVID-19. Why? Because we realized for those who took chloroquine or hydroxychloroquine with or without an antibody, the rate of mortality was higher in this group. Meaning that the rate of mortality was the lowest among the control arm. Those who didn't take neither chloroquine nor hydroxychloroquine with or without an antibiotics.
Okay.
And then secondly also, not just the fact that the rate of mortality was lower among those who were without any antibiotics or hydroxychloroquine, also the severity of the disease seems to be higher for those who took hydroxychloroquine, chloroquine with or without an antibiotics. And the specific disease that was observed is this de novo, they call it the de novo ventricular arrhythmia. Arrhythmia is an improper beating of the heart, be it irregularly or be it faster or slower. So there is a kind of dysregulation of the heartbeat in the group of those who took chloroquine or hydroxychloroquine with or without a macrolide, antibiotics.
Okay.
Yes. So actually, we are like coming back at the beginning of the disease, and we are also now asking ourselves what's really happening, and maybe this is really an opportunity for Africa to come forward.
Okay.
Because now WHO is supporting the product from Madagascar. WHO, they want the product of Madagascar to be tested conventionally.
Okay.
So not just from observational study, but they really want to implement standard clinical trials. And if this product is successful, then it means the Madagascar product will be accepted worldwide. But that said, also, we have in Cameroon cases like the product of Archbishop Klega. We need them also to have political backing for them to also go through this standard process. We also have in Yaoundé people like Dr. Eloge Mfopu, who has a product. We don't know if it's working effectively. I have been informed informally that he has treated about 40 patients. That's like last 2 weeks. All the 40 got recovered, but we don't know effectively, were they critical cases, were they mild cases? We don't know exactly what's the overall condition of these patients. So that said, putting together, you also realize we need a specific drug against COVID-19. It may be in Africa, it may be somewhere else, but all we need is a specific drug. Like in the Americas nowadays, they are trying 4 different combinations. One, they have realized the virus uses an RNA polymerase during its replication. So now they are trying to put in place an RNA polymerase inhibitor that's going to act directly on the virus. It's what they call the remdesivir antiviral. They have also realized now, beyond the ordinary opacity that we see in the lungs due to pulmonary affection, there is also what we call the disseminated intravascular coagulation. So patients are dying even though they are under respiratory assistance just because they have blood clotting. And to resolve this blood clotting now in America, they are using what they call the G-dimer. G-dimer is an anticoagulant, which is going to help to limit blood clotting in the process of physiopathology during COVID-19. Then they also use IX6. IX6 is an interleukin blocker which reduces inflammation.
Okay.
Yes, and all this put together helps them to make sure patients get relief from COVID-19. But all we know is, as African, maybe we have the best solution in Africa, and we really have to back up our own local evidence for them to become worldwide standard.
Thank you so much, Doctor. Quite interesting development there from the world of science and what we know about COVID-19 thus far. But I hear that they are trying vaccines and that a vaccine might be ready by the end of the year because, like epidemiologists say, that to successfully handle a virus, you must go through a vaccine and not treatment. Am I right?
That's right. To handle the virus, you need to develop a vaccine, yes, but maybe you also need to have a therapeutic approach for those who finally they are infected. Now, in terms of vaccine trials takes more time as compared to clinical trials, exactly, where you use a molecule and look the direct effect. And actually, what we know about a vaccine trial for COVID-19, there is a good news, a partially good news, because during our last seminar on Monday, Europeans provided their preliminary result showing that there is an antibody neutralization process for all the 3 human coronaviruses. We know for the human coronaviruses, we have the coronavirus 1 that appeared before. Then we have the MERS, which is the Middle East Respiratory Syndrome virus. Then now we have this coronavirus 2. So this broadly neutralizing antibody is able to neutralize about 50% is effective among 50% of those who have received these antibiotics, this vaccine, I mean.
Yes.
So the vaccine protects about 50% of the population. But now what we don't know is this protection lifelong? Is this protection going to diminish 6 months subsequently or a year after? That's why we need follow-up studies. Because at times, a vaccine might be protective just for a short while, and maybe you need a second dose effect. And a vaccine also might be impaired by the viral strain that keeps changing over time, which for now we don't know effectively about COVID-19. So we'll keep watching.
Yes. Is there any trial of any vaccine anywhere on the African continent?
At the moment, I'm not really aware of a trial going on. We are aware that Senegal is in favor of implementing a vaccine trial. But the major barrier to vaccine trial in Africa is the issue of people not feeling really compliant, people not really accepting vaccine trials. In the past, even with HIV vaccine, we had many trials that got interrupted, even in Cameroon, because there wasn't a good understanding on the importance of a vaccine trial. And actually, for the case of COVID-19, people just believe COVID-19 vaccine is to introduce other health issues like reducing the rate of natality in the African continent and other issues.
Those are social media stories.
Yes, so there are social media stories, but they have a significant impact on what we see in the clinic. Actually, also people don't really show up in the health facility. Also because they are like, if I'm going there, I may get COVID-19 rather than being treated. So that's the context that we have actually.
Okay. We've had... thank you so much. The 2 other guests have almost played the role of they're just watching. It looks like a lot of people have come back to wearing the mask, but like he just made mention of information on the social media, there's a lot of propagation of information that the mask is instead having some health effect, which might not be very, very good. And that's deterring some people from picking it up and putting it on.
Yeah, I think those who say such stories are those who are out to promote that virus and propagate it. Because I understand that marks principally and basically prevent you, first of all, from that direct air contact from someone who sneezes or coughs. And most people in streets, like in Yaoundé and Douala, where I've been to of recent, I realized that most of them are reluctant to wear that particular mask. There are 2 forms. There's the cotton form and there is the cloth. Now, people prefer the cloth because it is accessible. The cost cost about 200 francs, 400 francs. But the cotton form is difficult to come by except you have links with a medical practitioner or someone who has a direct supply.
I saw them sell it. They were selling it the other day on the market.
Yeah, and some are scared to buy those particular brands because they're not sure of the source. Because we are aware of stories that people just go and concoct things and they say they are medically balanced and of standard. But I think that Cameroonians need to understand the importance of wearing a face mask. Having one is not enough. You must have at least 5. That 5 means that if you mean every day you change a mask, change it. Treat that mask as an underwear or innerwear. It's health. Your health is wealth. And that is why African intellectuals, in their letter to African leaders, said that this virus should be handled as an urgency, not as an emergency. Because as an urgency, it gives room for public policy reforms whereby the health system, the hygienic system will easily be reformed through these basic hygienic rules like the wearing of face masks, the washing of hands. Like in markets, you go to markets, they complain that they are crowded. That crowded nature is not the problem. The problem is, are the people clean? Are they respecting good hygiene rules? That's the problem. Because if you go to the Western world, we have markets that are neat. When you enter there, you feel you are in a maybe let me put in quote, at the presidency because of the hygienic nature. And it tells you that nowhere is bad to be clean. Everywhere should be clean. Treat your marketplace like your home. The hygiene you respect or you implement at home should be done same at the marketplace.
Okay, our municipal authorities are disinfecting our markets of late.
Exactly.
They have been doing so.
Yeah.
Now, there are those who are looking at the mask from the perspective of cost. Others think that it suffocates, and others think that it is something that it should be worn sparingly when you are with people. From your own observation as a keen observer of societal comportment, what is the attitude of the people vis-a-vis this face mask, which it's like part of the dressing code, given that in places like Hong Kong, they've been wearing masks even before the outbreak of COVID-19?
Yeah, Joe, I think I just followed what Cham said, that there's some correction, which I think I'm quoting a medical doctor who has been here. He says, before I answer a question, that we're supposed to change the face mask after every 3 hours. You don't wear it for 1 day. I think when you look at our society, I mean Cameroon, before the last readjustments of the confinement measures that were taken, almost everybody was wearing their face mask normally. But remember, it was a Friday when the government asked that bars can get open till whenever, nightclubs. It gave the impression that we were done with Corona.
No, people misinterpreted.
But that is what I'm saying, Joe. And from that day, most Cameroonians, I bet you, just believe that forcing them to put on the facial mask is like you're just trying to disturb their lives. Because
we saw the authorities in Kribi the other day, led by Senator Mbamba, on the streets. Yeah. The president, in his address on Tuesday, said wearing of mask is mandatory.
Joe, what I'm saying is there are two things here. Government has to go beyond just dishing out those instructions or, coming on TV to say what we hear them say. We need to have repressive measures like you are quoting Kribi. Secondly, we don't see a lot of informative outings on part of the government because people still do not understand that if you put on the mask while in public, you or protect yourself against contracting the virus. And then again, if you are an infected patient, because you live with people in the house. So it is a two-way traffic. It is not just about the people you meet outside. If you go out and bring the virus, you are not careful, the entire household is infected. So people have to know that putting the mask or wearing it as often as possible, especially where you are in a gathering of more than 3 people, even if you are at work or at home, I think it should be recommended.
Okay. What you say is right, but you know that the media is there to educate, and the state or government officials pass through the media to get to the public, and so that's what we've been doing just on the set, and that's what your paper has been doing as well.
Of course.
Yes. You wanted to chip in something?
Yes. This issue of work at home, of recent, I think the idea of work at home hasn't been transmitted well. For example, work at home, workers, be it in the private or state. But work at home, you discover that will not work well with people in the informal sector. That there's a mother who sells food in Bangem or in Konye or in Mashe Mukulu. You say work at home, it means that there's a particular measure.
That's for a certain group of people. Not
that
everybody
will not
can
tie with her.
Yes.
Which means that it comes back to us insisting and emphasizing that hygiene is primordial.
You're right.
Yes, hygiene is primordial.
Yes, but you know that there are certain professions or certain things which we do which you can't work from home.
Exactly.
Like when you have to have direct contact with the public.
Those people should respect hygiene.
Yes. Now, can you say something briefly on the wearing of face mask as a scientist, and also maybe educate us on if you put on your mask and you're feeling suffocated, what does that mean? Does it mean you shouldn't wear it again? And if you want to wear it, when should you wear it? And so on, for how long should you put on your mask, and so on and so on? Maybe you say a word on that.
Okay, yes, you know, about the mask, actually, before COVID-19, we just knew in Cameroon we had surgical masks. Surgical mask is what you see surgeons that they wear these masks when they are doing a surgical intervention. And this is a disposable mask that you use just once, and you have to dispose it 2 to 3 hours subsequently. And actually, with COVID-19, we are seeing many people wearing the surgical face mask also, which is the conventional mask. The surgical face mask generally is preventing the wearer with the mask from like spreading the virus outside. So it is mainly used for those who are carriers of the virus, because if you have a surgical face mask and you have somebody near you who is infected and he coughs directly in front of you, you may get the infection. You may get, I'm not saying you must get, but you may get. So surgical face mask is mainly used for patients and maybe those who are asymptomatic carriers to make sure they shouldn't spread the virus around. So that's the first use of surgical face masks. Now we have what we call a respiratory mask. Respiratory mask, just as a coincidence, this is an example of a respiratory mask. In the US, they call it N95 code. In Europe, they call it FFP2 mask. These FFP2 masks, they prevent both from receiving the virus and from spreading the virus. That's the role of a respiratory mask. And that's why respiratory mask is mainly designed for those who are working within high-risk environment, like in the hospitals, or maybe you are like in a market where where it's a bit crowded. It would be ideal to have a respiratory mask. Yes,
and not a surgical mask.
And not a surgical mask, because if somebody really coughs directly in front of you and you have your surgical mask, the virus may go through. That's quite effective.
That's interesting.
So that is where let me just come back again to what I said. Please. I think government needs to come in. I mean, even with a team of medical doctors, you know, to let the public, because we may be, just like he is saying, we may be thinking that we are being saved by wearing.
This is the information you're getting. How do you want government to come in again?
We need some kind of display on TV.
But this is what he's saying. Huh? What type of display again do you want?
Joe, we are saying that it has to be recurrent. We find on CRTV newscast, the 7:30 and 8:30, they go to the center where medical doctors are interviewed to give updates on the evolution of the virus and treatment and deaths. They should, during that process, let the public know that this one is not good, this is not good, this is good, this is good, so that when we go out to buy, we will know what we are supposed to buy.
Okay, your preoccupation is taken. Yes, doctor?
It's maybe just to highlight better, it doesn't mean that wearing a surgical face mask, you are 0% protected. Yes, it protects at a certain level, but not 100% as one may say. What is important for us to know is, if everybody systematically wears even just a surgical mask, if everybody wears a mask, for 4 weeks, coronavirus will be gone. because nobody will be able to transmit the virus to the other. I mean, even just our simple local masks, if everybody put on a mask for 2 to 4 weeks, it means nobody will transmit the virus to the other. The virus has an incubation period and may go as long as 2 weeks to 4 weeks for the majority of cases. A few cases go beyond, yes. But for the majority, it's 2 weeks. So after 2 weeks times 2, we will be able to contain the virus. If everybody just put on surgical masks, coronavirus will be gone. But now, how effective is it?
Now,
yes.
Now,
I have a worry which I just want him to answer, please. It is very good for my person.
I'm the one asking the
question.
No,
I'm not asking. I don't want to put it. I'm not going to ask a question. Joe, we have seen sometimes during the night, I go about, I have been journalist, I see people sit in bars and off licenses. They just push the mask below their chins. And they're drinking. I mean, for 2-3 hours. I don't know how safe that is. That is to the people, and they don't maintain.
That certainly is not safe because it's not a cheap mask.
That is why I still come back to say that government took a very wrong measure by asking that bars should get open.
Okay, that's an opinion. Yes. Okay. I'd like us to break a bit and go to what has been discovered here in Yaoundé. And when we come back, we'll talk about the side effects of living with COVID-19. Thank you so much.
It is in this hospital at Kradat neighborhood in Yaoundé that the cardiologist carried out a research on the treatment of COVID-19. Results of his findings of a drug named Corocure have shown that a combination of traditional and modern medicine holds promise for the treatment of coronavirus patients.
The products which has been discovered, you have seen it is extract of a plant. It is heterogeneous because it contains the extract of the plant plus an excipient. And then the patient has to take it. The cure, it is at least 8 days.
The cardiologist hypothesized that Corocure is a possible therapeutic approach as a number of persons tested positive are now relieved after taking the drug.
I receive many patients with no problem with cardiology but with COVID-19. I receive their consentment and then I give them the plant. Antibiotics plus the plant, the groups which receive the herb plus the antibiotics, I've seen their clinic state ameliorate very rapidly.
He is presently working in collaboration with the Ministry of Public Health in order to put the therapy for use by coronavirus patients.
Okay, thank you so much, Ewane Pule. That's one something which has cropped up within this the community now: fear, and this seem to have gripped almost everybody. The fear to catch the disease. What's the mortality? Before he talks about that, what's the mortality rate? You just talked about 3 point.
Yes, in Cameroon, our latest data showed 3.6% case fatality rate. So among those who are positive, we have like 3.6% who died. We went up to 4.7% last week, but we have reduced a bit during this previous week.
Are those the people who die? Is it associated with a second disease, or it's the virus only that affects and kills?
Yes, in our context, actually, we don't have this detailed data. I guess it is still really confidential at the ministerial level. But what we know is that those who often die, they have some preconditions. For example, one, they are the elderly. Yes, be it in Europe or in America, what we know is those who are beyond 70 years, or at least 60 years, they have a higher risk of mortality. Then second, also, those who have other comorbidities. Comorbidities, for example, if you are a diabetic patient, if you are hypertensive also, if you have any previous lung disease, if you have any other serious medical disorder, you have a higher risk of mortality as compared to those who do not have these diseases. So these are like some of the few issues that really propagate or favor the risk of mortality for those who really have COVID-19.
Okay. What do you tell people who fear?
I tell them to pray, because prayers is the only key. After
to fear?
When you are afraid, you pray. You pray to have hope, because when there is hope, there is life. And like the head of state said, don't panic, because when you panic, that's a sign of fear. And fear kills more than a disease. And fear now is a manifestation of a psychological defeat. And psychology is the worst thing in times of health crisis, because it can kill you before you discover that you were negative even. And that is why when HIV even came up some years back, people died because of psychological stress. That thought that, am I positive? Am I positive? Am I negative or what? Now, the first thing after fear is that distract yourself. Go to recreational centers.
Okay, no, forget
about yourself. It's very important.
Yes, let's hold that for now. The president talked to the nation on the 19th and dwelled for 17 minutes on COVID-19. This shows the seriousness of the disease.
Yeah, Joe, before I answer that question, I think the idea of fear, because the guiding post, we actually ran a report on that. We appreciate the efforts of our medical doctors, but they're actually helping more people to get frightened with COVID-19, because they seem to give the impression that everybody who dies now is dying of COVID-19. And so that has actually helped to, implant the fear into the minds of so many people, which means that when you are told that you're positive to COVID-19, you start getting frightful, or no?
Frightened,
so,
yeah.
Frightened, sorry.
Okay.
That, doctors have to really encourage people.
I know the Minister of Public Health came on CRTV to say that people were not going to hospital again because they were afraid that they will pick up the disease or COVID-19 from hospitals, which is not the case. But the most important thing is that in spite of COVID-19, people are still falling sick, malaria is still there, typhoid is still there, and other diseases are there. So what should be the attitude of the ordinary Cameroonian vis-a-vis the disease, doctor?
I have not answered that question about the head of state.
It's because you twisted it
off.
No,
I didn't twist it. I'll
come back.
No, Joe, let me answer the question.
Okay.
I think, let me say this here. Many Cameroonians have been asking where the president was in the face of COVID-19. And I think, in my opinion, he did well by coming out on the eve of a very important day, our national day. But the fact that he devoted more than 17 minutes talking only about COVID-19.
It was 17 minutes.
17 minutes. Mm-hmm. That was something to draw the attention of Cameroonians that COVID-19 is real, and that even if, as he said, we should not panic, we have to be on the watch out so that we don't get infected.
And stigmatization too.
Okay. Yes, I'll come to that, but doctor, you got my question, or I repeat it?
Yeah, please repeat.
Okay. I was talking about this, the aspect of panic and the contributions of the medical world to help people, even psychologically, when they're handling the disease. I hear there are different types of, different levels of infections. What should the medical doctors communicate now in this time of COVID-19?
Yes, Joe, effectively the right word is communication. And I will maybe base my evidence from a practical experience that I had. When there was lockdown in Cameroon, there were cases that came from so many European countries, Asian countries, and there is one guy who came from Indonesia. I'm sure he's watching us actually. And this guy was put on confinement because he was positive. And I don't know how he got my number. They called me, and they told me the guy is not sure his result is positive. And this guy, he wants to escape from confinement because he's afraid that he's going to, that he got the virus, but within that confinement milieu, and that his positive result even, he's doubting that result because he believes there must be a mixed-up, because he is feeling fine, he has no symptom, so he believes he's not positive. So I had to retest to request for a retesting of this sample. And they retested the sample, he was still positive. So I informed him of his result, and he still didn't believe. So I told him, according to our national guideline, they will still collect a new sample subsequently to like a kind of follow-up of your infection. They did that. Around day 19, he was still positive. And the guy almost got mad. So what I did is I called him and I told him, please, there is a good news for you. You have a very good immune system. Your system is really controlling the virus, and you are already within the recovery phase. Very soon, you have a negative result. Believe me, this guy was very calm. And got so kind, 3 days subsequently, when they repeated his test, he was negative. And when he came out, he keeps calling my phone just to come and show a sign of appreciation for a good communication. So the key issue is communication. Okay. Is communication.
Thank you so much.
If you communicate effectively, yes, I think people will also adhere on our preventive and prophylaxis measures, and will surely alleviate the burden of the disease.
Thank you. Victor, there's a lot of behavioral change that has come with COVID-19. And this seems to be impacting a lot of people. And what have you observed as a consequence of the advent of COVID?
Yeah, at individual levels, people now scarcely move around, just anyhow. People have controlled agendas. People get up in the morning, like where I live, people get up in the morning, they go to the market, a nearby market. They go in the morning, buy what they will use in the afternoon and in the evening, and they don't go out till the next morning. Now,
okay, control movements.
Yes, exactly. Secondly, eating habits. In the morning, today we'll go and buy puff. They call it pap, but nowadays it's no longer there.
Prepare food at home.
At home.
Yes. Next.
Yeah. Next, the aspect of there's a woman next to my compound who sells in the market at they call it Marché Acacia. Mm-hmm. She goes to the market in the morning by 8 a.m. By 3 p.m. she's back. 3 p.m. she's back. She bakes the kids, prepare food for them, and that is all. Okay. So there is a lot of controlled lifestyle within the family. Okay.
Yeah. Thank you. At the level of community attitude, have you observed any changes in your neighborhoods?
Well, I think, honestly, when Cham was talking, I was like, maybe he's talking about something that's happening in another country, because that's not what I see.
Maybe in his own neighborhood. What have you observed in yours?
Generally, Cameroonians still behave as if there is no coronavirus. You need to go through Mokolo or Marché Central. Yesterday, I had an issue with my phone, and at some point, I felt like I should just leave. I saw people just sitting very close to each other without any face mask. You move, around the markets, not just that it's dirty, but people are just too carefree.
Now, is it those who frequent the markets, or what about other areas?
Leave their homes and go to the next home, and they're playing with others without any distancing measures or without taking care of the hygienic condition which government is talking about. So, honestly, we need to drum this into the minds of Cameroonians, because a lot of people are still behaving as though there's no coronavirus.
And then there's another thing I forgot to mention. What doctor said. Most people around my neighborhood are now scared to go to the hospital. There's a culture of, I will not say all, most nurses, the way they communicate. Some say they even call you by the name of a disease, I hear like a joke somewhere. But I think it's something very serious. There's a need for the Minister of Public Health to educate medical practitioners, especially nurses.
No, that's the role of you as a journalist.
No, we do.
The minister.
I've been doing it. I came up with.
When it becomes an issue, the minister will speak about it.
I think before it becomes an issue, he should speak proactiveness. He should first of all talk about it. It's being proactive. If not, people can die of psychological stress and trauma.
Okay.
Yeah.
Now, You just mentioned there about the carefree attitude, but there are a lot of people who say that some of the attitude, because the informal sector in the country is extremely high, and that some of the behavioral patterns are guided by the fact that the informal sector, people who work or earn a living from the informal sector, have to continue.
I agree with you, Joe. You see, when you look at some of the measures that government came out with, you know,
the 19 measures.
The 19 measures. I thought that we would behave like what we see in other civilized countries. For instance, government would say, within this period, they would shoulder the burden of electricity bills, water bills, and telephone bills for those who have telephones.
Every country has its own.
Yeah, but Joe, this is what I am saying.
Mm-hmm.
I have realized that my electricity bills and my water bills have instead gone up.
Because you're staying at home more.
That is not it. That is to say that people know that if you don't pay electricity bill, you'll be disconnected. And so what they do is they care very little about coronavirus because they have to survive. Remember, even the WHO has warned that hunger is what may finally kill people. And so everybody is trying to, you know.
So what's the relationship?
What I am saying is that government should have taken some of those burdens, like electricity bills, water bills, and telephone bills, at least for 5 months.
You want government to pay a bill for you?
I don't complain paying, but the common man cannot pay those bills because he cannot do his business like he used to do before.
Joe, I think the government too. I think the government is trying to mitigate between trying to not forget that the SDGs, which are the 17 SDGs, which are there, should not be relegated.
There are 20 in number.
They have been added, which means that hunger, poverty, malnutrition, and crisis to serve people who are living in destitute environments and all whatnot, which means that the government should not forget the fact that hunger and poverty have increased. And suppressing bills like water bills may cause government more harm than good, because government can instead subsidize. That way it will be easier for government to handle such crises.
It will be wrong for you to sit here and play advocacy for government. Joe,
no, it's not advocacy for government. It's not.
Joe,
it's risky for government to suppress water bills.
Let me just come. Cham, we didn't have Labor Day this year. We didn't have National Day. We know how many billions we spend on these two activities or festivities. Why can we not divert that money to subsidize or even take care of our electricity bills?
I think it is too early, in my opinion, because it's just May 20 on Wednesday, and today is Sunday.
That one was budgeted.
Oh, okay. Maybe they're planning for it.
We know that it's having a lot of impact on individual budgets, individuals in society, but government has taken measures. It might not be enough for you, or what you expect. Now, maybe from your observations, I'd like us to begin and would end with the doctor. I was informing you earlier on that we won't have Tike today because he's not feeling fine, so your comments will not be read today, but we'll do that next week when Elvis is back. What, from your observations, what would you tell the Cameroonians today concerning the preventive measures? Doctor said earlier on that if we wear our mask for 4 weeks, we would eliminate the virus from Cameroon. What have you observed and what can you tell Cameroonians?
Yeah, I would tell Cameroonians not to be negligent. It's very risky. It's costly. It costs your life to be negligent, which means that from today henceforth, we should do everything possible to have a mask if you can't have more than one. And we should respect hygiene rules, because having a mask is not enough. Like he did make mention of, we have 2 types, the surgical and the cloth. If you have the cloth, make sure you wash it on a daily basis. And make sure that people who wear the mask, it's not a chin mask, it's face mask. Or to an extent, it covers the nostrils and right down to the chin, which means that you must respect the medical prescriptions so that you live healthy, and you must protect the life of the person next to you. Father and mother should not think that because they are father and mother, they cannot transmit it to the next person or to the children. No. I think if you can respect hygienic rules right inside the house, we can still do that in the community, which therefore implies that if in the past we had the habit of getting up in the morning, going out anyhow, we should limit it. Movement to matters.
Okay.
Move based on necessity.
All right.
Joe, it is true that Cameroonians like drinking a lot.
Outdoors activities.
No, I'm talking
outdoor
specifically
activities.
about drinking. Because if people can learn to, for those who cannot do without alcohol or without drinking beer, I think the best thing we can do, to stay away from the pandemic, people should develop the attitude of going to the bar with their facial mask on. You buy from the counter and then you take home and drink. Because when you get into a drinking milieu, you first of all lose sight of the fact that you have to put on your mask. First of all, you cannot be drinking while the mask is on. But if you buy and go home where you are sure about the environment, you will limit the chances of contracting or spreading the virus.
Okay. There are people who say that the beer is sweeter, or I don't know how. Because
but you can drink. You have a family, of course. You drink in a family, with your family members.
When you drink in the bar itself. Okay. Doctor, you earlier on you wanted to give us some practical advice on maybe what to drink, what to eat, how to do certain things to be able to limit, besides wearing mask. Is there any practical thing you want to share with us on the program this midday?
Yes, Joe, without attempting a holistic understanding on COVID-19 management, there are those basic habits that we know they are very helpful. Like our local traditional meals really contain so many antioxidants, so many anti-inflammatory markers that really helps in alleviating the burden of the disease. What we know is that everybody has the same risk of being infected, but there are different levels of risks in terms of getting the disease. Being infected is one thing, getting the disease is another. So within our local environment in Africa, we know our food habits are very helpful, even if we are infected, in terms of protecting us from not developing the COVID-19 disease itself. This is one important factor also. We also really want to beg, because the government is putting in a lot of effort. We are working day and night for COVID-19 testing and management. If you have any clinical sign, be it in any region of Cameroon, we have managed to decentralize so that you can be tested wherever you are. You don't need to travel from one big city or one region to the other. There is a big effort in terms of local management of COVID-19. Then also one important fact that you mentioned during this program, there is no need of being stigmatized because you are a COVID-19 positive patient. Why? Because COVID-19 is simply a community transmitted infection. It can easily be transmitted from one person to the other. The virus has what we call a contagious index of 3. 3 means that one person can infect 3 other people during his infectious period. So the virus easily gets transmitted. We also know that the virus in America is slightly different from what they have in Europe, and the virus in America transmits faster as compared to what we had in Europe and in China. But God so kind, the virus in America is less aggressive as compared to the one we have in Europe and in Asia. What do we have in Africa?
Yes.
We really need further studies to understand it effectively.
But ours came from where?
Ours, as you rightly mentioned some weeks earlier, ours came from Europe. But in that process, we know in Africa we have a different climatic condition. We have so many different other issues
parameters
that might prompt the virus from readjusting.
Okay.
And maybe the very last important issue is now in Europe and in America, they have controversy in terms of chloroquine activity, hydroxychloroquine activity with the antibiotics. They now want to do a standard randomized clinical trials. It's also a chance for Africa to also implement a similar randomized clinical trials with our own local product. Maybe we may end up winning the game.
Thank you so much. With that, we end this edition of the program. We might end up winning the game from the doctor, the African continent. But before we win that game, let's implement the protective measures. Stay with CRTV if you can. Good day.
CRTV News, ici, toute l'info.